in this training, we're going to cover what we're going to look at some overdose data for Montgomery County specifically. We're going to talk about what is an opioid. We'll look at what recognizing an opioid overdose, so looking at the signs and symptoms. We'll talk about responding to the overdose, so we'll look at the use of naloxone. We'll discuss the importance of rescue breathing, contacting EMS, which my colleagues kind of mentioned earlier, caring for the person, tips for prevention, and then other resources in the county that can support as well. I had some notes, but I think I'm just going to do it off the top of my head. So, all right. So in Montgomery County, looking at some stats, in 2020, we lost 139 lives to overdose deaths. Naloxone was administered 521 times. Lives saved by administered naloxone was 492. And of those 139 overdoses, 108 of those were opioid overdose fatalities, which was an increase of 25% from 2019. In 2021, we lost 158 lives to overdose. Narcan was administered 624 times, and lives saved by naloxone administration was 605. So those two naloxone administration numbers could be duplicative, meaning a person could be administered naloxone on multiple occasions, just multiple times of experiencing overdoses and things like that. Oh, one data piece I wanted to make sure I shared is that fortunately, we get a lot of data from the Maryland Opioid Overdose Operational Command Center. I know that's a lot to digest. Montgomery County fortunately saw a 29% decrease in fatal overdoses in 2022 in comparison to 2021. Yes, in 2023, those 40 overdoses are all fentanyl related, and we're definitely trying to address that issue as well. But we've also seen declines as far as heroin related overdoses. So working with clients, they talk about there's no heroin anymore on the streets. You can't really find it. So we're doing a lot of work to try to address this issue, and we've been doing a lot of work, and we're going to continue to do that work in the county. We added this slide in the presentation just to give a glimpse of how we actually got to where we are today. A lot of times you can't really address what's going on unless you know where you came from, right? So this gives information. So the DEA did a research study on the amount of pharmaceutical medications that were ordered by pharmacies, and we pulled out the data specific to Montgomery County. So in 2006, you can see pharmaceutical numbers at around 11 million, but it jumped up in 2010 to 16 million and then stayed above 16 million over the course of the next couple years through 2012. So anytime I speak with anyone who was dealing with opioid overdose, a lot of times they tell me I started off with a prescription that was prescribed by my doctor. So about 70 to 80% of all the people who are dealing with opioid use disorder these days started off with a pharmaceutical that they might have gotten from a doctor. I also recommend a documentary called The Crime of the Century, which was put out by HBO. Tells you a clear depiction about how we got to where we are. Talks about the Purdue Pharmaceutical Company, about the Sackler family, and definitely the challenges that we're experiencing. So looking at what is an opioid. So an opioid is any drug or containing opium or its derivative. It's natural or synthetic. Can come in a prescription drug, medication, or a legal drug. Can be a pill, capsule, powder, or liquid. Can be swallowed, drunk, smoked, snorted, or injected. An opiate is a natural form of opium. So examples of that could be morphine or codeine that a person might get from a doctor. And an opioid is a synthetic version, meaning it's man-made in a lab. That was an example of that is fentanyl, which is what we're seeing a lot of today. These medications these drugs are used to manage pain, suppress a person's cough, treat opioid use disorder, causes feelings of euphoria, contentment, or detachment. And one key thing to think about is the effects can last in the body between 3 to 24 hours, depending on how what type of opioid a person takes. And in excessive amounts, an opioid suppresses a person's ability to breathe. So thinking in terms of your immediate release, opioid medications, you got oxycodone or hydrocodone. You might know the name of Vicodin. Those can last in the body about 4 to 6 hours. Then you have extended release medications like your Oxycontins and morphine, which you might get prescribed in the ER. Those can stay in the body between 12 to 24 hours. And then your drugs like heroin and fentanyl can be in the body between 3 to 5 hours. So, which of course is a lot stronger than those other opioids that I mentioned. These here are just some examples of these prescription opioids. So you got oxycodone, hydrocodone, So oxycodone is the most commonly misused and abused prescription medication in the country. Hydrocodone is something you might be prescribed if you have a tooth removal or tonsil surgery or something like that. You also have oxymorphone, which is the brand name is Opana, which we never really see much anymore. And then you also have hydromorphone, which is coined the name of hospital heroin. Other examples, you have morphine. So morphine is the base opioid, which all other medications are pretty much created. Thinking in terms of how strong it is, heroin is about 3 to 50 times stronger than morphine. Fentanyl is 100 times stronger than morphine. And then you have carfentanil, which is an animal tranquilizer, which is about 10,000 times stronger than morphine. And then there's another animal tranquilizer that we're seeing out that's in the drug supply called xylazine, which Narcan isn't even effective on. You might have seen imagery on, say, social media in other cities across the country. Codeine, of course, is the prescription stream medication, cough medication. What people do is they'll mix it with a soda or some kind of hard candy to mask the nasty flavor of it, but they don't put it in the same class as an opioid. And a lot of times when people use codeine excessively and they stop, they experience some of those withdrawal symptoms with codeine, which is seizures. And a lot of people don't associate that with codeine use, excessive codeine use. Then you also have methadone and buprenorphine, which are your opioid antagonists, which are used to treat opioid use disorder. We put this image in here just to give a clear depiction of what a lethal dose of heroin and what a lethal dose of fentanyl looks like. So you can see it only takes a few grains of fentanyl to kill a person. And unfortunately, this drug is being used and laced with other substances or just pressed to look like other substances. And people are utilizing it, not knowing it is fentanyl or knowing that fentanyl is in the substance that they're using as well. But you also have prescription strength fentanyl as well, which is prescribed by to a person who might be dealing with end-stage cancers, pain, or some kind of habitual pain and things like that. The top image on the right, you have a transdermal patch, which is actually the only way I've seen research that shows that fentanyl can soak into the skin through a transdermal patch. So a person will wear this patch for about 48 to 72 hours, but it will still have about 50% of the medication in the patch. So a person comes in contact with it, they're not prescribed fentanyl, they could experience some of those ill effects from that fentanyl. And then you also have the young boy in the screen who has a fentanyl lollipop, which of course might be prescribed by a doctor as well. But recently, as of probably like last spring, we might have seen imagery around rainbow fentanyl. Which was very scary at one point because it was around Halloween and people were very fearful of it, thinking it might be mixed with candy and things like that. But just because it's very brightly colored, pressed to look similar to like the ecstasy pills that people might take or the Percocet Perc 30s and things like that. So pills, powder. Also, you can see the image there looking like blocks of sidewalk chalk and things like that. So you might come in contact and not even know exactly what it is. And then, of course, everyone knows pretty much about heroin. These are just some slang terms, not really indigenous. But I think at one point in time, we were mainly seeing the white powder heroin that was detrimental. But at that time, people were mixing things with the heroin, which was wreaking havoc on the body as well. All right, but of course, you got your non-pharmaceutical fentanyl, illicitly produced synthetic drug, can look just like a pill, can be powder form similar to heroin. And we know that fentanyl plus heroin is a very deadly combination, 100 times stronger and more potent as well. So then you also have your counterfeit pills. So criminal drug networks are mass producing these fake pills, falsely market them to legitimize prescription pills. I heard a few weeks ago someone talking about the shortage of Adderall in the pharmaceutical supply and the fear that people may access the street Adderall thinking it's the same thing, but 10 times out of 10, just like the officer said, when you test these drugs, they have fentanyl in them. So a lot of times, anything you find on the street is going to have fentanyl in it. You have your Percocets, they look just like Percocets. You have your Xanaxes, they look just like Xanaxes. You have your Adderalls, you have the ecstasy pills. You have all those different pills because what these drug networks are doing, they're pressing these pills to look just like the pharmaceuticals you might get from a doctor. And people are thinking, oh, it's similar to what I got from my doctor, so it must be safe. But that is not the case. So recognizing that opioid overdose. So what happens is an opioid overdose happens when the toxic amount of an opioid overwhelms the body's ability to handle it. So this happens when a person uses an opioid alone or they mix it with other drugs like alcohol, benzodiazepines, cocaine, and other things like that. What leads to the overdose is respiratory failure. So it's lack of sufficient oxygen in the blood. The vital organs like the brain and heart start to fail, and it leads to unconsciousness, coma, or death. So one of the key pieces to surviving that opioid overdose is breathing and oxygen, which I'll get to in a moment. Some of the signs and symptoms to look for when a person is experiencing that overdose is slow, shallow, or no breathing at all, unresponsive, unconscious, loud snoring or gurgling noises. So meaning that they're sounding as if they're gasping and they're trying to breathe. The body could be limp, meaning they don't have control over their being able to sit up and things like that. Lips, fingertips could turn blue or gray. Skin could be pale, gray, or clammy, and pulse could be slow or erratic. So responding to that overdose. So one of the main tools that we use to respond to an opioid overdose is naloxone, or the brand name Narcan. So it's the medication that's used to reverse the opioid overdose by temporarily restoring breathing. This medication wears off between 30 minutes to 2 hours. It's safe for children and pregnant women. There are various delivery mechanisms. So you have intramuscular, intranasal, or intravenous. In Montgomery County, we only train and we only provide the intranasal version. So if you've ever had allergies, which when I moved up north from North Carolina, I got allergies, and I've used Flonase. If you've ever used Flonase before, that's the same mechanism you would deliver the Narcan to an individual. No potential for misuse, no effects on someone who hasn't taken an opioid. So sometimes if a person runs into someone who's unconscious, then they may administer Narcan to rule out if it's an opioid overdose or not, and then proceed to the subsequent other life-saving strategies. Naloxone is only effective in reversing an opioid overdose. So if it's an overdose on just cocaine or on another substance, then naloxone is not going to be effective. So storing naloxone. So we recommend to not open the naloxone until you're ready to use it. Store it in its original packaging. Keep it in at room temperature. But there's been some new research that has come out to let us know that you can leave it in your car and things like that, and it won't really be damaged by the extreme heat or cold and things like that. Keeping it safe away from children and pets. Naloxone does have an expiration date, so we typically try to provide naloxone that has a 2-year window after we train you. Sometimes that's not possible, so we always tell you to be mindful of that expiration date. But the Department of Defense actually did a research study on naloxone to show that it was effective about 5 years beyond its expiration date. So people will actually call us and say, "Hey, my kit expired. Can I get a new kit?" Yes, you definitely can. We'll get you a new kit, but we also recommend to keep the other kit just in case you need additional doses for any situation. So what happens with the overdose? So in our brain, we have opioid receptors. When a person takes an opioid, the opioid binds itself to the receptors, impacting the person's ability to breathe. When you administer naloxone to reverse the overdose, naloxone has a stronger affinity to the receptor, so it basically comes in, kicks the opioid off the receptors, and potentially restoring breathing temporarily. So how do you respond to that opioid overdose? So you have 5 steps. So you rouse and stimulate, you call 911, you give naloxone, you provide rescue breathing, and then you care for the person. So rousing and stimulate, you shake them, "Are you all right?" You call their name. Can you wake up? If they don't wake up, then you make a fist and point out your knuckle and do a sternum rub. And if you rub firmly enough, that pain could potentially wake them up from what they're experiencing. Next step, you call 911. Reason being is because getting medical help for someone experiencing that overdose is very important. Of course, the naloxone is only temporary. So remember, I said it only lasts between 30 minutes to 2 hours. An opioid can be in the body between 3 to 24 hours. There's been instances where a person has been administered naloxone, and after that window, they went right back into that overdose. So that's why it's important to get EMS there. They might have other health complications. They may need more naloxone. There's been instances where a person needed up to 7 doses of naloxone to be administered to be revived. That's how potent and how strong these opioids are. And that's why it's important to educate ourselves and be aware and be equipped with Narcan. And then it may be a non-opioid overdose. So next step, step 3, you give naloxone. So basically in the kits that we provide, we always put medical grade gloves in there just to basically try to protect you from any bodily fluids and things like that. So you peel the tab to open the Narcan nasal spray. So it's going to look similar to this. It's going to come in a little medication bag just like this in a Ziploc bag. It looks just like a Ziploc bag with some writing on it, but it's pretty cool. All right, so it comes in a Ziploc bag. So you hold a Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle finger on either side of the nozzle, like I have here and like on the screen. And then you tilt the head back and support the person under the neck, gently inserting the tip of the nozzle until your fingers on either side of the nozzle at the bottom of the nose. So once you insert the tip into the nose and you have their head back, because you want to tilt the head back because you don't want the spray to kind of drain out. You want to, it's like a mist that is squirted, that you're squirting into the nose. And once you press that plunger firmly, then that is 1 dose of Narcan, all right, which is equivalent to 4 milligrams. So after you administer that 1 dose, you want to allow it about 1 to 3 minutes to take effect. But while you're waiting for that Narcan to take effect, you're providing rescue breaths. All right. So if the person is not already laying down on a flat surface, you want to grab your face shield. So in our kits, we always give one-way face shields, of course, to protect you from any bodily fluids. People are still fearful of COVID and things like that. I've heard, well, what if they have residue of fentanyl or anything around their nose? Of course, that's why we give you the face shield, to try to protect you from any of those instances and things like that. So you lift the chin and tilt the head to open the airway. Check to see if anything is in the mouth. If it's something blocking the airway, you want to remove it. And then you want to take your face shield. And with the face shields we provide, they have a little face on it. So you shouldn't mess this up. All right. They have a little face on it. So you make a complete seal over the person's mouth with your mouth, and then you blow 2 regular breaths. You then give 1 breath every 5 seconds. And if the chest does not rise, you want to retilt the head and give another rescue breath. So you want to do this for that 1 to 3 minute window while you're waiting for the naloxone to take effect. But you're trying to keep an internal clock in your mind. And so after that window is closed, if they haven't woken up, then you can administer that 2nd dose of naloxone. Then you want to continue the rescue breathing until EMS comes and relieves you, right? So step 5, caring for the person. So you want to stay with the person until medical help arrives. If the person cannot sit up, you want to put them in the recovery position, which I'm going to show you in a moment. You want to keep them calm, try to encourage them not to take any more opioids. A lot of times people wake up agitated, mad, because you done basically kick their high off. They are confused, you know, and a lot of different emotions that they may experience. And if the overdose happens again and you haven't administered that 2nd dose, then you can administer that 2nd dose of Narcan on that person. So if you have to leave, of course, even briefly, you want to put them in a recovery position. This keeps the airway clear and prevents choking or aspiration of vomiting. One of the withdrawal symptoms from an opioid is vomiting. So you want to make sure that it doesn't matter if you lay them on the right side or left side. You just want to make sure the top knee is bent, the top arm is with the hand under the head, and that helps to prevent them from rolling on their back in the instance you have to leave them. If you administer naloxone, we always recommend that you contact poison control, just because they help collect data, and that helps the state to continue to fund programs like this so we can provide Narcan for free. If you've been made aware or watching the news, you notice that FDA just approved naloxone for over-the-counter. We don't know how much it's going to cost. I've heard in the range of $100. I've heard different things, but longest we have an ORP in Montgomery County, we'll continue to provide it for free. Tips for preventing. So these are just mainly just some risk factors associated with opioid overdoses. So the quantity, so starting slow and going slow, the quality, so same supplier, trusted supplier, getting it from different places. So we always say use fentanyl test strips to try to test to see if the substance has fentanyl in it. But I'm telling you, 10 times out of 10, it probably does. Using alone. So we always try to help encourage people to have prevention plans in place. So in the instance you're going to use, or if someone you know is going to use, you want to have the ability to check on that person just in case they overdose. First use, so a lot of overdoses happen when a person is recently released from a treatment program or recently released from incarceration or something like that. So those recent abstinences, mixing drugs, of course, age, and physical health. All right, so some key resources. So one of the key resources that was already kind of shared was the Good Samaritan law. So this law protects any individual who is assisting in the emergency overdose situation, or the individual who is experiencing the emergency overdose situation. So if you have 3 friends together and one person is using and that one person overdoses and those other 3 friends are there, if one person calls 911, if one person administers naloxone, if another person does the rescue breathing, and then you have the victim, all of those individuals are protected under the Good Samaritan law. And I've confirmed that with the state's attorney's office. So it does not protect anyone who is witnessing the overdose. So if you're just witnessing, then that person was not protected. But of course, law enforcement is still going to try to gather data because they're trying to go after the supplier. They're trying to get the supply off the street and things like that. So how to get naloxone? So completing a training, which you're doing right now. You can get it from a pharmacy, which of course there may be if you use your insurance, there may be a copay associated with it. And then of course, our syringe services program, which is located in Rockville off of 1500 East School Drive. Local resources. So the county has access to behavioral health, which is our access point to mental health and substance use services. A person can get a free health screening, a mental health screening or substance use screening and get referred to appropriate care. You also have medication assisted treatment located in Rockville as well. So this is the number here. Harm reduction services, which is a part of my office. We provide Narcan information refills, training, education on harm reduction, and things like that. And then you also have peer support services. So you heard the officer mention how law enforcement is deployed out to all of the overdoses, where peers are also get an alert from fire and rescue to try to engage that client who has experienced that overdose and try to connect them with services and things like that. And then we've also worked with fire and rescue collaboratively. They will leave a kit behind with the victim who has experienced an overdose, as well as all of fire and rescue have kits at their fire stations as well. So we supply them with all of those as well. So this training was created by the Health General Article Title 13 in the state, and then Code of Maryland Regulations Title 10, and that is my training. So we do have kits for I believe we have enough kits for everyone, but in the event we run out, I have a QR code that you can scan with your phone, and we will mail a kit to your house.